Good afternoon, everybody. I'm Bob Lazaro, Executive Director here at the Northern Virginia Regional Commission. Welcome to our webinar on the immigrant community of Northern Virginia, economic impact of COVID-19. And we're pleased to present this webinar with our partners at the Community Foundation in Northern Virginia and the New American Economy. Some brief housekeeping tours and then a brief introduction. This webinar is being recorded and it will be posted on NVRC's demographic webpage and NVRC's immigration study webpage. All attendees will be in listen-only mode. Questions for the presenters can be posted in the chat room and we will take them up at the end. In this age of COVID-19, I'm obligated to tell you to please, when you're out, please wear a mask, wash your hands, employ physical distancing, and if you haven't already, please get your flu shot. This study, a little bit of a background, in March of this year, in partnership with NAE and the Community Foundation, we issued a report on the economic impact of immigrants in Northern Virginia. That report was issued in March. It was overtaken by the events of COVID-19. As everyone's attention was towards the pandemic, and the state made available data related to ethnic and racial information on COVID cases, NVRC started to see through our demography office a disturbing trend about the impact of COVID-19 on the immigrant community in Northern Virginia. And as such, we then turned to our friends at NAE and Community Foundation to do an addendum to that original report to capture that impact, which we'll find today has been quite substantial. Today's presentation will start with a presentation from Jill Caniff, who's our Senior Regional Demographer here at NVRC, who will share with you some of the data on COVID-19's impact in the immigrant community. We will then hear from Mo Katner, Director of Local and State Initiatives at NAE, who will talk a little bit about our previous study to give you some flavor to that, and also what we found in our addendum to the study. And then we will hear from Eileen Ellsworth, because this has not been a government-only effort. Folks in philanthropy, NGOs have been working hard to help the local residents and businesses in our community as well. With that, I will turn, and please bear with me, I'm going to turn my screen over to Jill, who will begin the presentation. So Jill, it's on with you now. Excuse me, Jill, you're muted.
All right. Sorry, everyone. Bob just told me I was muted. I am Jill Caniff, and I am the Regional Demographer for Northern Virginia Regional Commission. And I will be presenting to you the COVID-19 case data, as well as the demographic analysis that has gone along with it that led us to want to do the addendum to the immigration study. So first is the COVID cases by race and ethnicity in Northern Virginia. The shares that you're seeing here have been calculated using only cases with reported race and ethnicity. And through October 19th, 82.4% of our cases reported a race and ethnicity. So that's a very large percentage that have reported. In the beginning of the pandemic, it was not collected greatly, this race and ethnicity data, but as the pandemic rolled along, it became more of a requirement to collect this. And so we've gotten a great amount of information on this to make some great analysis and conclusions. As you see in this slide that I've shown you here, the Hispanic share of cases is very disproportionate compared to their population. Their population is 17% of Northern Virginia, whereas the cases are above 50% of all cases during this entire pandemic. The Hispanic share of cases has been 3 times their overall population. So that is a very huge disparity. And this disparity has occurred in all the health districts of Northern Virginia. So it is very widespread. When considering the cumulative cases that you're seeing here, that it's now 52.5%, well, earlier on in the pandemic, it was in the upper 60%. So they were a very hard hit community early on and still are very hard hit, but not as hard. Hispanics and minorities are generally more socially vulnerable than other populations. Hispanic immigrants in particular, they are more socially vulnerable than other populations because a large percentage of them are frontline workers. They're lower income in many cases, and those Hispanic immigrants are not always college educated. So this we will talk in more detail about in the next presentation after mine, but that's really what is certainly a big factor in the Hispanics being hard hit that we should keep in mind as we look at this information and consider how to overcome this pandemic when considering this population's needs. And another thing to point out before I move on from this is that out of all Hispanics in Northern Virginia, 52% of them are immigrants. So when seeing this data, that really pushed us to want to expand our study. In terms of hospitalizations, the shares have been about 98.1% of hospitalizations reported out of all of them. So we got a great sample size and very reliable. The Hispanics have been disproportionately affected for hospitalizations as well. They are nearly, I should say, 3 times their overall share of Northern Virginia's Hispanic population. And for all health districts, the hospitalizations for Hispanics have been 2 to 4 times their overall share. So again, this indicates a significant ethnic disparity in our region. And in terms of deaths, Hispanics have not been disproportionately affected. And we have 97.3% of all reported deaths have had a race ethnicity associated with it for our analysis. So Hispanics and Latinos in Northern Virginia have a similar share of deaths, like I said, as well as all health districts also have a very fairly similar share compared to their overall population, except for Prince William County, which has had a significantly higher share of disproportionality on the Hispanics. Then when looking at the weekly trend to see, well, have we been improving over time with the Hispanic disparities? That is what you're seeing here. At the beginning, on the far left of this chart, it was June 27th is where this trend line begins. And in June 27th, Hispanics were 66.5% of all weekly cases, whereas today, the gap between Hispanics and all the other races has lessened. Today, we're at 41.2% of weekly cases being Hispanic, instead of 66.5% that was at the beginning of this pandemic, when the data started to be collected. And so these changes are likely attributable to a couple of things. One reason is that leaders and community groups in the region have been very active in reaching out to these hard-hit Hispanic communities to educate them, provide information in their languages so that they can be educated on the pandemic and how to prevent the spread of it, as well as providing services such as hotel rooms to socially isolate. So educating and providing this assistance has been critically important to controlling the pandemic in our region. A second reason that the gap has lessened in our region is that phase 3 began on July 1st. So that is immediately after the trend line began that you're seeing in this graph. So July 1st, we began the phase 3 opening. So once places began to open up, the pandemic spread more heavily to your non-essential workers and the general population, rather than just mainly your frontline workers. One thing that helps us as governments and nonprofits and others that want to reach out to the communities to know which communities are vulnerable and need services and need to have special services and education and be targeted for these special needs. One measure for doing that is the Social Vulnerability Index. This Social Vulnerability Index information comes from the CDC and has been used for years by the CDC. And we just, in Northern Virginia, began using it during this pandemic. The vulnerable populations, they have been greatly studied by scholars and are widely known to be most at risk during disease outbreaks and human nature disasters. So that is why we wanted to start using this, especially at the beginning of the pandemic when little was known about the pandemic and there was little data to really guide us at that time. So this allowed us to prepare and respond to our disease outbreak with this social vulnerability information, which again, in case you're unaware, the social vulnerability measures an area's resilience to the disease outbreaks, as well as human nature, such as natural and man-made disasters, such as hurricanes. And the SVI index, which I'll show you in a minute, indicates the relative social vulnerability of every census tract that there is in our region, as well as Virginia and nationally. The Social Vulnerability Index has 15 social factors that are grouped into 4 major themes. And these are used to determine the overall rank of every census tract out there. The factors include data on education, family characteristics, housing, language ability, ethnicity, vehicle access, and economics. A comprehensive assessment of all these factors is provided by combining all these 15 factors into a social vulnerability index. So back at the beginning of the pandemic, NVRC created this specific dashboard, which is on our Northern Virginia dashboard site that you can get to through NVRC's main webpage. And once we give you this PDF of the presentation, you'll also have the link to the SVI dashboard. So in that dashboard, you'll have all the census tracts mapped, and you'll be able to see which ones had high vulnerability. And so those high vulnerability ones are the ones that are really vulnerable and need the greatest attention for services, which are the dark purple. Since that social vulnerability index was done at the beginning, since then, several months later, zip code data finally became available. And we have mapped that, and you can find that on our website as well, where we've mapped, in the darkest of green are the areas that had the highest case rates per 10,000 persons as of October 19th, 2020. These places with the highest case rates have remained pretty much consistent throughout the entire pandemic. So they have been very hard hit. And what we did with this information was we overlaid it with the social vulnerability information to see if there was a correlation between where the vulnerable populations were and where the worst case outbreaks were happening. And so what we found was through our analysis, which I'll take you to right now, we found that social vulnerability was greatly correlated with where the top 20 zip codes of highest case rates were, which are those areas in red. Those are the zip codes with the highest case rates. And of all the census tracts in the region, 49 out of 55 with the high social vulnerability index, 49 out of 55 of them were in these top 20 zip codes. So that is a great indicator of the COVID pandemic affecting the socially vulnerable the most. And those socially vulnerable also include the immigrant population as well as the Hispanics, which I'll show you here in a minute. Okay, so this is our story map that goes with that information you just saw, and you can explore it more on your own, but the important thing to know is those 49 out of 55 tracts with the high purple were correlated. But then the other thing to know is, was there a correlation between the Hispanics and where they live, as well as these top 20 zip codes that had the highest case rates? And the answer was yes. The Hispanics are shown in this map. They are the green areas. And what this map is showing is what race and ethnicity is predominant in a census tract. So in the case where there's greens, the Hispanics are the predominant race and ethnicity. So you can see all the green areas are primarily in the areas that also are outlined in red, the highest zip codes. And then when it comes to the foreign-born, are they correlated as well? And we found that yes, they are. And you can see the darkest of blue are where the foreign-born live. And those darkest of blue that are within the red are primarily Hispanic foreign-born populations. Whereas those along like the 66 corridor are more of your Asian and white populations that are foreign-born. So certainly when you compare the Hispanics, where the Hispanics live and where the foreign-born live, it's really the Hispanic immigrants that are very affected from this pandemic. And so that is on the immigration and foreign-borns and race and ethnicity side of things. But in regards to the senior population, which we all thought at the beginning of the pandemic that they were the most vulnerable, well, that was not correlated with the top 20. So that tells us that the primarily vulnerable populations were the immigrants as well as the Hispanics. Let's see. And let's see, lastly, just wanted to mention that all this information that I've just shown you is maintained on a daily or weekly basis on our Northern Virginia region dashboard, which you have a link to right here. And then also on this same dashboard is where you will find the new addendum report posted that we will present right now, which we'll turn it over to our presenter of that new addendum, as well as the former report. Thank you.
Thanks, Jill. Thanks, Jill. I'm going to turn it over to Mo now. Hey, Mo, you need to unmute yourself.
There we go. Sorry, my computer was having an issue with letting me unmute myself. But hello, everyone. Thank you to Bob and Jill for your comments. Thank you to everyone for joining this webinar today. Needless to say, there is a lot happening in our world right now. So your attendance is a real testament to how important this issue is. So again, I just thank you for your time and attendance. Again, my name is Mo Kantner. I am the Director of State and Local Initiatives at New American Economy. I am going to start with an overview of NAE and then just a quick note on some of the trends that we see nationally before diving into the data from our original report published back in March of this year. And then I'll go over the findings from what we're releasing today, which is the addendum to that earlier report. So for some of you that might have attended the original release of the report back in March, this first part might be a bit of a review and a refresher, but it should help set the stage for the addendum and why we focus specifically on the immigrant community in regards to the effect of COVID on them. If folks have any questions or want me to go into further detail, please just include your question in that chat function of the webinar. I believe we're going to go through all of the presentations and then circle back to Q&A at the end. So let's get started. So New American Economy, we are a bipartisan research and advocacy organization that is fighting to change the narrative about immigrants in America. So instead of focusing on the polarization that's happening at either side of the political spectrum, we really look at the economic imperative for immigration reform. So NAE was started about 10 years ago by a bipartisan group of civic, municipal, business, and political leaders who really believe that immigration is fundamentally an economic issue and wanted to talk about it in a different way. So in our work, we use original research to quantify exactly how immigrants are an economic asset at every level of our economy and in every community. And then we use that narrative to bring together leadership across industries, across the political aisle, and across cities and states to advocate for and implement policies that reflect the reality that we need immigration. So the state and local team, which is the team that I head up, has been around for about 6 or 7 years. After comprehensive immigration reform kind of fell apart a bit at the federal level, we saw a real desire from local leaders to be more proactive in approaching immigration issues within their own communities. So within the state and local team, our work centers around 3 main pillars. We work at the local level with municipal and civic leaders. We work at the state level with governor's offices and statewide departments. And then we work with the business community through chambers of commerce and with business coalitions. So increasingly, despite rhetoric that we hear from traditional media, from social media, and from others, the number of Americans who believe that immigration is fundamentally good for our country is increasing. This graph might have you believe that NAE was founded and then single-handedly changed Americans' minds on immigration, which is obviously not true, but it does show that we should not always believe some of this divisive rhetoric that's out there. So why is this important? This is important because the U.S. currently has a lower birth rate than previous generations, and without immigrants, many communities across the country are really at risk of not being able to grow or even sustain their local economy. So no major U.S. metros have grown without immigrants in the past 50 years. And so immigrants are really already a fundamental part of our national conversation around growth and prosperity. So using all of that kind of national context or background, let's focus specifically on Northern Virginia. So to begin, I'll just note that the report covers the Northern Virginia region, Arlington County, Fairfax County, Loudoun County, Prince William County, as well as the independent cities of Alexandria, Fairfax, Falls Church, Manassas, and Manassas Park City, and that the data for this report is from the 2017 American Community Survey. And we define an immigrant as anyone born outside the U.S. and not to U.S. citizen parents, so regardless of status. And so staying true to national trends, in Northern Virginia between 2012 and 2017, we note that there was a 10.8% overall population increase, but there was a 19.4% increase in the immigrant population. So immigrants are accounting for over 45% of the population growth in the region. And without immigrants, the region would have only grown by about 5.9%. So looking at raw numbers, we see that the immigrant population in 2017 was a little over 670,000, which is well over, 500,000 residents in the region. And so this accounts for 27.4% of the population in the region, which is more than double the national average and way higher than the average for the rest of the state. So immigrants are playing a really integral part of the Northern Virginia story. So now a critical part of our research is understanding who immigrants are. So Northern Virginia is really interesting. It's probably no surprise that nationally, Mexico is the most common country of origin for a foreign-born person. But in Northern Virginia, Mexico doesn't even break the top 5 countries of origin. And the largest group from El Salvador makes up 12.5% of the foreign-born population. So this tells us that the Northern Virginia region is extremely diverse, not just in what portion of the population is foreign-born, but where that foreign-born population is from. So immigrants from all over the world are resettling in Northern Virginia. With that said, we also know that this pandemic is affecting different people in different ways. So when I transition to the COVID addendum, I'll spotlight the impact on the Hispanic immigrant group. So all this is great to know, but why is it important that we include immigrants as part of our economic development strategy? I alluded to this earlier, but the reason that immigrants are currently playing and will continue to play a really outsized role in economic development efforts is because the U.S. population is getting older. By 2065, the median age will be 42. We have baby boomers that are retiring, with 10,000 baby boomers turning 65 every single day, and a declining birth rate. So this is leading to major shortages across industries in our labor force. And immigrants can play a really huge role in counteracting that. So immigrants are more likely to be of working age in Northern Virginia, with 84% being of working age versus 62% of their US-born counterparts. And people of working age are really critical for filling these workforce shortages. So despite all of the volatility that we've seen in the labor market this year, there are still industries and sectors that need workers, which again, I'll go into more detail when I switch over to the COVID addendum. So this immigrant population leaves a really significant economic footprint. They have a tax base that supports the city's infrastructure, a workforce that attracts business and drives job growth, and a solid foundation of consumer spending that really goes back into the local economy. So we can see that immigrants contributed $57.7 billion to the region's GDP in 2017. And from that, nearly $2.1 billion went to state and local taxes, and more than $5.9 billion went to federal taxes, which left immigrants with $20.3 billion in spending power or disposable income, which can be infused back into the local economy when they shop at grocery stores, at retail stores, at restaurants, etc. But when we say disposable income, it also means that immigrants can purchase homes, providing yet another way that immigrants can contribute to the local economy. So over 56% of immigrants own their own home, with a total property value of $71.8 billion. And then the other share of immigrants who rent pay $2 billion in annual rent. But let's pivot for a second and talk about how immigrants are able to contribute so much to the local economy. So while just 27.4% of the population, immigrants are 31.3% of STEM workers and 59.5% of construction workers, meaning immigrants are really uniquely positioned to fill in some of these workforce shortages at all ends of the skill spectrum, including in industries in Virginia and nationally where we've seen shortages. So, one major industry where we're seeing a shortage of workers, and this trend has continued through COVID, is in STEM, science, technology, engineering, and math. In Virginia in 2016, there was a ratio of more than 9 open STEM jobs to every 1 unemployed STEM worker. And when businesses and employers can't fill these open positions, it can mean more than just stunted economic growth. These businesses can really become slower to adapt to trends. It restricts their ability to innovate and their ability to remain nimble in some really rapidly changing markets. But beyond STEM, immigrants are playing a really outsized role in several other key industries in the region, including construction, 59.5% of construction workers, 39% of healthcare workers, and almost 47% of hospitality workers. Over 34% of finance workers in Northern Virginia are foreign-born as well. So we see immigrants playing a really outsized role in a number of different industries across the region. And with this income, immigrants are also supporting a number of entitlement programs, which is critical to note within the context of the fact that, nationally our population is aging and is aging out of the workforce and will increasingly rely on these programs. So in Northern Virginia, immigrants paid more than $2.9 billion into Social Security and more than $784 million into Medicare. And additionally, just to put this into a bit of national context again, immigrants contributed $182 billion more to Medicare than they drew down between 1996 and 2011. But immigrants are more than workers and taxpayers. They are also entrepreneurs. And as we can see, immigrants are really punching above their weight in terms of entrepreneurship rates. So across the country, immigrants are far more likely to be entrepreneurs than their US-born counterparts. So between 2005 and 2010, the rate of immigrant entrepreneurs nearly doubled. And even after the recession in 2013, immigrants bounced back as entrepreneurs just as quickly as their US-born counterparts, which could be very telling for our current situation that we find ourselves in. So immigrant entrepreneurs are driving growth, both in job creation and in local economic activity. And across the country, we see that immigrants are more likely to be entrepreneurs and employing over 8 million Americans and generating $1.3 trillion in sales. And specifically in Northern Virginia, immigrants account for over 42% of all entrepreneurs. This makes them almost 47% more likely to be an entrepreneur than their US-born counterpart. And these more than 47,000 business owners generated $1.3 billion in business income. And the top three industries for foreign-born entrepreneurs include professional and technical services. So, for example, industries that require a high degree of expertise and training, such as an IT startup, legal practice, architecture, etc. There is a high proportion of construction foreign-born entrepreneurs, and then a high proportion of foreign-born entrepreneurs in general services. And by general services, we mean kind of the repair and maintenance, laundry services, social services, etc. So immigrant entrepreneurs are making really significant contributions to the economy, both on the main streets of Northern Virginia, as well as being heavy hitters in the business world. So across the country, 44% of Fortune 500 companies were founded by either an immigrant or the child of an immigrant. And in Virginia, over half, 52% of the Fortune 500 companies were founded by either an immigrant or the child of an immigrant. And on average, each new American Fortune 500 company employs over 62,000 workers, which is 12.1% more workers than the average number of workers at a non-new American Fortune 500 firm. Sorry, it's a bit of a mouthful. And together, new American Fortune 500 firms employ over 13.7 million people, which is a population larger than the entire state of Virginia and would rank as the 5th largest state in the country, with $6.3 trillion in revenue. So despite this, we know that immigrants come from all types of backgrounds with all types of skill sets and contribute to the region really in a wide range of ways. So given the national rhetoric and the urgency of finding a solution for Dreamers, I do just want to highlight some data looking at the economic role of the undocumented population in the region. And understanding this can really just give us a more holistic look at the role of immigrants in the region. So there are about 196,000 undocumented immigrants in the region who earn a combined annual income of over $3.9 billion, with $321 million going to federal taxes, with $150 million going to state and local taxes, and leaving them with more than $3.4 billion in spending power. So the undocumented population is having a significant impact on the region. And additionally, we can focus in a bit on the urgency for a permanent solution for Dreamers. So Dreamers are people that were brought to this country as children that have grown up in Northern Virginia and want to fully participate in the Northern Virginia economy. In June of this year, the Supreme Court actually ruled that the current administration did not properly dismantle the DACA program, but they did not say that dismantling the DACA program was illegal, simply that the manner in which the administration did it was not proper. So as a result, the administration is continuing to look for ways to dismantle that program. Now, the DACA program was never meant to be permanent. Members of all parties recognize that congressional action is really necessary to create a long-term pathway. But ending the program without a long-term plan will really only lead to missed economic potential for the DACA population and missed economic growth for our local communities. So we can see that in Northern Virginia, of the more than 22,500 DACA eligible, that 91.9% of them are employed. They earned a combined annual income of over $482.9 million. They paid $71.9 million in federal taxes and $44.7 million in state and local taxes. And that left them with more than $366 million in spending power. So again, while this program is still temporarily in place, there really is an urgent need for legislative action to provide a long-term solution for these young people. And then the last thing I want to leave you with before we dive into the COVID-specific addendum is the naturalization rate and opportunities for Northern Virginia. So we find that 51.3% of immigrants in the region have naturalized, but over 83,000 of the 83,000 people of the foreign-born population is likely eligible to naturalize. So why is that important? Immigrants who decide to naturalize are able to access more opportunities. They aren't reliant on employer sponsorship, and they tend to have higher earning potential than their counterparts who do not naturalize. And then particularly because in less than 2 weeks, many new Americans will be voting for the very first time. We've actually recently produced research on our NAE site on how naturalization and immigrants are changing the demographics of voting blocks in swing states across the country. So with that basically sums up the report that we released back in March. I am now going to transition to the addendum that we're releasing today. But again, just a quick reminder that if you have any questions, feel free to input them into the chat box, and we will get to it at the end of the presentations. So again, on March 12th, we quickly transitioned the release of the New Americans in Northern Virginia report from an in-person event to an online event. This was not our preference, of course, but we at NAE, the Northern Virginia Regional Commission, the Community Foundation for Northern Virginia, like the rest of the country at that time, were really forced to adapt to the situation at hand. So at NAE, we as a team quickly realized that we needed to shift our resources and support when the pandemic struck. We realized that one of the best ways that we could support communities in this brave new world we found ourselves in was by providing research and resources for decision makers to make smart, tactical decisions in support of their communities. So we started a portal on our website dedicated to COVID-19, which we have updated on a weekly basis every week since mid-March. We particularly focused on the role of immigrants in essential industries like healthcare, like the food supply chain, IT and broadband access, teachers, et cetera, to get us through the emergency response, and then also took a look at immigrants in essential industries as we look at what a recovery could look like. So the role of immigrants in mental health industries or biomanufacturing and pharmaceuticals as we look at possible vaccines. We also worked with state leaders in a number of governor's offices across the country to help them with their responses. So in some states, it involved a county-by-county language access analysis. In other states, this included helping them understand their healthcare worker needs so that they could enable short-term licensing opportunities for healthcare professionals that were trained in another country. And then we also worked with individual communities. And this is when we were approached by the Northern Virginia Regional Commission at this time to assist with understanding how this pandemic was affecting immigrants in their community and where resources could be utilized. So this includes ensuring that communities know the role of immigrants as, again, workers in essential industries, immigrants as entrepreneurs that might not get support from federal aid packages, and what the language access needs were, since, again, health and public safety information really needs to be very clearly understood by all members of a community during a pandemic. So with that, let's take a look at what we found. I will say that, as a quick caveat, that the data that we were able to provide in this addendum is actually based off of the 2018 American Community Survey. So this is a new data set that had been released between when we pulled the data for the report released in March and this addendum. So some of the numbers may be ever so slightly different. So for example, in the previous report, we noted that the foreign-born share of the population in Northern Virginia was 27.4%. In this addendum, it notes that the foreign-born population is now 27.6% of the population. So for all of you who are paying very, very close attention to detail, yes, we do know and we acknowledge that some of the numbers for the addendum are slightly different from the numbers that we just went over from the report that was released in March. With this in mind, we see that the immigrant population, both in terms of raw numbers and as a proportion of the Northern Virginia population, is still growing. We see that the foreign-born population is 27.6% of the Northern Virginia population. Again, still significantly larger than both the national average and the state of Virginia. Yet, despite just being 27.6% of the population, immigrants accounted for almost 48% of essential workers, including over 60% of construction workers. And these essential workers are based off of the federal government's guideline for essential workers. So in fact, if we look at the top essential industries for foreign-born workers across Northern Virginia, we see immigrants playing an outsized role in a wide variety of industries, from over 50% of food service workers to over 40% of healthcare workers and over 28% of utility workers, which, considering most of us are attending this webinar from the comfort of our own homes, is incredibly important. So additionally, I'd note that immigrants account for almost 57% of workers in essential services, which includes certain categories like veterinary services, services to buildings and dwellings, waste management services, child daycare services, and on an incredibly morbid front, funeral homes and cemetery workers. But overall, we can see the incredibly important role that immigrants are playing during these unprecedented times. So let's dive a little bit deeper. If we look at the top 10 occupations within the essential industries that have the largest share of foreign-born workers, we see that 93.8% of the maids and housekeeping cleaners are immigrants, that 78% of construction day laborers are immigrants, and almost 60% of childcare workers are immigrants. But let's drill down into an industry that even prior to the pandemic was incredibly burdened. As I mentioned near the beginning of my presentation, the U.S. Has an aging population. So to nobody's surprise, we find that there is a huge workforce demand for healthcare professionals. Healthcare is the fastest growing industry across the U.S., and this was prior to the current healthcare pandemic. So from more hands-on positions like personal care aides or nursing assistants that help with some of those more day-to-day tasks, to the physicians and surgeons, the healthcare industry desperately needs an influx of workers. And this is where immigrants can play a major role. So while nationally immigrants tend to be registered nurses at about the same rate as the US born, they are twice as likely to be both nursing or home health aides and doctors and surgeons. So they're filling critical roles at all ends of the healthcare skills spectrum. And that's only being exacerbated by both an aging US population and obviously the current pandemic that we find ourselves in. So if we look specifically within healthcare industries, we can see that there is a really high concentration of immigrant workers within certain sectors. So they make up 65% of home healthcare services, 63% of workers in nursing care facilities, and half of all workers in residential care facilities. And if we dive even deeper into the healthcare sector, we see a really high concentration of immigrant workers in specific occupations, including 71% of nursing assistants, 69% of personal care aides, and 43% of all physicians in Northern Virginia. Again, acknowledging that immigrants account for 27.6% of the population. So we can see the incredible role that immigrants play, not just in filling workforce gaps, which they do, not just as economic consumers and contributors, which they are, but in working to keep us all safe and healthy during this healthcare crisis. So with that in mind, I'm just going to switch gears a little bit from ways that immigrants are supporting us and look at how we can support immigrants in the region that may be disproportionately affected by COVID. So we know from our report released in March that immigrants are creating jobs in the region. There are over 47,000 immigrant entrepreneurs that are generating $1.3 billion in income in 2017, and they're almost 47% more likely than their US-born counterparts to be business owners. So we wanted to take a look at immigrant entrepreneurs in non-essential industries. So being a business owner in a non-essential industry means that the likelihood of COVID and lockdowns having a large effect on their business is quite high. And because immigrants are less likely to be able to access federal relief packages, they're at even more risk for a severe economic impact because of the pandemic. So looking at the top 3 non-essential industries with the largest concentration of foreign-born entrepreneurs, we see that immigrants account for over 59% of personal services. So that would include nail salons, hair salons, barbers, etc. They account for 41.5% of retail trade store owners and over 33% of social services and non-essential healthcare entrepreneurs. And another huge factor at play is access to healthcare. So this pandemic is a health crisis. And while certain jurisdictions or states can provide free testing, not all areas provide free care. And even when care is offered for those suffering from COVID symptoms, it can be very difficult and confusing to navigate this system. So while we note that just 4.4% of the US-born population in Northern Virginia does not have health insurance, over 21% of the foreign-born population does not have health insurance. And another factor at play when coming to terms with some of the disproportionate impact of COVID on some of these vulnerable communities is language access. So at the beginning of this presentation, I noted the diversity of the backgrounds of immigrants in the Northern Virginia region, which is, a bit of a blessing and a curse. So the region now has to grapple with the different language needs of this very diverse population. So we note that Spanish is the most commonly spoken language at home other than English at 31.1%, followed by Korean at 5.5%, Arabic at 4.5%, and Vietnamese at 4.4%. And understanding this is really crucial because this disease, does not care if you were born here, if you're a refugee, if you're a naturalized citizen, and it certainly doesn't care if you speak English. So getting health and public safety information as well as economic resources and support information to everyone in the community is really critical. So another factor that we evaluated was the comparison of average household size for the US-born population versus the foreign-born population, broken down by income quintile to try and give a bit more of an apples-to-apples comparison. So as we can see, in every single quintile, the foreign-born household tends to, on average, be larger than their US-born counterparts. However, in the highest quintile, the two populations are almost at parity, with the US-born households averaging 1.8 people and the foreign-born population averaging 2 people. And when we compare that to the lowest income quintile, we see that the average US-born household is 2.9 people and the average foreign-born household is 3.8 people. And this is important because, as we know, the virus is spread by people in close proximity with one another. That's why we have these 6-foot social distance guidelines. So larger households are really at risk of an infected person spreading the virus to more people. And then another aspect that we looked at in this addendum report is access to internet in the home. I imagine a number of you on this webinar, have had the luxury of being able to work from home since this pandemic began. But I would really be incapable of doing my job if I didn't have internet access. So likewise, many people with school-aged children have had, to some extent, needed to utilize some component of online learning to keep their kids' education on track. And what we find is that foreign-born households are nearly twice as likely 6.1% versus 3.1%, to not have internet access at home in comparison to their US-born counterparts. And again, this doesn't just impact those who might have been able to transition to remote working. It impacts kids that are not able to access remote learning. So taking all of these different data points into account, we decided to put together a case study specifically on Hispanic immigrants to try and better understand why, to Jill's earlier presentation, the Hispanic population seems to be disproportionately impacted by the pandemic. And what we found was pretty striking. The Hispanic foreign-born workers account for huge parts of the workforce in essential industry. So 50% of all construction workers, and that's not just foreign-born construction workers, that's 50% of all construction essential workers, 40% of essential service workers, and 25% of food service workers. And yet the Hispanic foreign-born population is even less likely than the overall foreign-born population to have health insurance, with 38.7% of the Hispanic population, of the Hispanic foreign-born population, uninsured. And additionally, they tend to have larger households, averaging 3.8 people per household as compared to 2.4 of the US-born population. And then lastly, they're far more likely to lack internet access at home, with 11.8% of the Hispanic foreign-born population not having internet access. And again, this impacts both the ability for a parent to work from home and their children's ability to learn and go to school remotely. So all of these are factors that could be impacting the incredibly high rate of infection within the Hispanic foreign-born community. But that being said, there is a silver lining. A lot of local communities across the country, including in Northern Virginia, are really stepping up to help support communities in need during this time. So I would definitely encourage everyone to check out the website on the screen for a listing of resources. And then I'll just leave you with one more resource. At NAE, we have a site called Map the Impact that has top-line data on the economic contributions of immigrants by all 50 states, by all 435 congressional districts, the 100 largest metro areas, and then just launched this summer at the county level for all 3,000 counties across the country. Although a quick note on that, that because of sample sizes, some of the counties, particularly in the more rural or less populated areas, can be counted. So if you're looking for stats in, say, rural Wyoming, we might not have it. But if the sample size is large enough, we do have that data, and that includes all of the counties that were included in this report. So with that, thank you very much. I am happy to answer any questions after Eileen gives her remarks, and I'm happy to hand it off. So thank you very much for listening. Much appreciated.
Thank you, Mo. And now we'll hear from our friend Eileen Ellsworth from the Community Foundation. I would just ask that we unmute Eileen's microphone, please.
Can you hear me now? All right.
Yes, ma'am.
All right, Bob, thanks. All right. Welcome, everybody. I wish we could be together today. It's great to hear this data reprised and to be reminded of the massive economic impact of recent immigrants on our economy. So Bob asked me to give you all an update on the Community Foundation's work, and I've got about 10 minutes here. I want to just spend the first 2 minutes going over what we've already done, which most on the line are probably already aware of. I'd like to spend the last 7-8 minutes talking about what we could do as a community going forward. So next slide, please, Jill. So we launched the COVID-19 Response Fund for Northern Virginia on March 13, the day after our Shape of the Region conference at which this data was first presented. And we said right from the start we were going to use the money that we collected to support those that were most disproportionately impacted by the virus and its economic and health consequences. To make a long story short, we ended up raising $2.1 million, and we awarded every dime of that back out the door in 110 grants. Next slide, please. So the first round, which happened 1 week after we launched the fund, was all about food and access to food. We simply picked the 5 biggest food pantries across the region, and we awarded $100,000, every dime of which came from Amazon, which was very quick out of the box to help the local community respond. Next slide. All right, round 2 was all about basic needs assistance and emergency financial assistance. 28 grantees, $360,000 awarded, not just food, but all manner of emergency financial help. Next slide. So round 3 came out in May. And at this point, it had become clear that the virus was, I don't want to use the word overwhelming, but it was really impacting the free clinics and the free and reduced fee clinics in their ability to provide day-to-day health care for our low-income residents. So round 3 was focused on boosting them, on giving grants to the free and reduced fee health clinics, mental health clinics, and dental health clinics. And also, we provided funding for a myriad of organizations helping victims of domestic abuse, because at that point in time, as you may remember, domestic abuse was just soaring under local stay-at-home orders. So 35 grants, $750,000 went out in round 3. Next slide. Round 4. So the second round of layoffs had occurred at this point. So we provided, we partnered with 5 intermediaries, folks that actually had very deep roots in local community, right down to the individual and family level. And we provided $280,000 to the 5 of them for direct financial assistance to individuals, things like payments of rent, payments of utilities, groceries, you know, things that were just going to help them hold up the sky until they could figure out their economic plan going forward. Next slide. And by the time round 5 came along, you know, the murder of George Floyd had occurred. And the data from the local health districts in Northern Virginia, particularly in the Fairfax Health District, showed that COVID-19 was having a very large and very disproportionate impact on recent immigrants. So round 5 grants were intended to both strengthen and empower communities of color and recent immigrant communities in our region, who were fighting on the front lines of not one, but 2 crises, COVID-19 and racial and social injustice. Next slide, please. So, you know, that is a summary of where we've been. So what's next? You know, this immediate response phase to the virus is over, and we're very mindful of the fact that we may be done with the virus, but the virus is certainly not done with us, not yet anyway. So there is a next phase of philanthropic response to COVID-19 and its economic and health impacts. And here at the Community Foundation, we're putting all of this sort of next phase thinking under a banner of an initiative we're calling Build Back, Dream Forward. And Build Back, Dream Forward has 3 goals: more equitable economic mobility, more racial justice and equity, and more inclusive economic growth. To date, we've awarded $100,000, including the grants that are listed on your screen right now. And they include investments in, so for example, I think the biggest one there is to George Mason University. They've agreed through their Mason Innovation Lab in the Center for Innovation and Entrepreneurship to run a 20-person cohort of nothing but minority and immigrant business owners for business coaching and business mentoring. And of course, the reason for this is what you just heard from Mo and Jill, the massive disproportionate impact, economic impact of the virus on those business owners. This also includes some grants we've made to local leadership and volunteer organizations to encourage them to leverage their own databases, to do their own convenings to promote racial justice and equity. The same is true of a couple of umbrella interfaith organizations on that list. So there are actually 2 additional community-based investments under Build Back, Dream Forward that are planned but not yet out the door, but our board has approved them, and they're rather interesting. And you know, Jill, if you want, I think you can just take down the slide at this point, and we can just see each other and chat a little bit. But so the first of these grants is a grant to Inside Nova, which is our local media outlet, to help them pay for a journalist that's dedicated to lifting up stories and voices from, hold on, can you see me now? Can you all see me now? Okay, great. It's dedicated to lifting up stories and voices from some of the underrepresented communities in our region, which mostly include communities with very high percentages of recent immigrants. And finally, our board has approved a grant of just under $60,000 that's going to support an endeavor by the Northern Virginia Economic Development Alliance. And that alliance's very proactive efforts to address this massively disproportionate impact of the virus on minority business owners. So the alliance is talking to a company called Eureka, which is an online platform dedicated to one and only one service, providing coaching, mentoring, and pitch service events to minority business owners. Their outreach to minority business owners is really their specialty, their ability to reach them, hook them into these cohorts, and our Economic Development Alliance wants to tap into that specialty. The program is actually going to entail the creation of 4 separate cohorts of these business owners of approximately 50 businesses per cohort. That's the hope. And the 4 cohorts would be structured around the 4 industries in the region, the 4 industry verticals that have been hit hardest by COVID-19, namely retail, restaurants and hospitality, personal services, and administrative and professional. And it's going to happen really soon. They're launching the program by November 1. So you just heard Mo and Jill make this remarkably compelling economic case for inclusivity. And, you know, our community foundation is pretty action oriented, and we're constantly asking, okay, what else can we do as a community, not just as a community foundation, but as a greater community to address these inequities that have been laid bare by the virus and its outcomes. I'm just going to share a little bit of data that has come to my attention that's pretty jaw-dropping. So Stanford University produced some data in May, and I just saw it referenced in a WBJ article I'm going to talk about too last week. So I don't think they've updated it. It was data through May, and it said that between February and April of 2020, so you're talking 2.5, 3-month period, 41% of Black-owned businesses shut their doors for good under economic pressure caused by the pandemic. Latinx and Hispanic business owners also experienced a major loss in that same time frame, with 32% of their businesses disappearing. Female business owners, 25% disappeared, compared with 17% of white-owned businesses. And the Washington Business Journal on October 15 came out with a story, and the only way to describe it, it's an expose on the inequities in our financial and economic systems impacting minority and Black-owned businesses. And the title is One System, Unequal Access, and the subheading is The Nation's Decade-Long Economic Expansion saw bank deposits more than double and commercial lending explode. And yet, during that same stretch, lending to Black-owned businesses had cratered. That's their word, not mine. An article by Matthew Kish and Malia Spencer. They quoted this data point about loans from this SBA, Small Business Administration, to Black-owned businesses having decreased 84% since 2008. It's got nothing to do with the pandemic. And 75% of initial PPP loans went to businesses in majority white census tracts. Only 3% of SBA loans in 2019 went to minority-owned businesses, down from 8% in 2007. And when you look at sources other than the SBA for capital loans and grants to minority business owners, it's the same story. I just don't think most of us understand the severity of the problem and how these trends exacerbate racial and ethnic disparities in wealth generation, home ownership, and consumer spending. Just step back for a second and consider that 69% of our country's GDP is consumer spending. Mo talked a lot about this just now. So it's people like you and me going out and buying cars and buying appliances and, you know, buying stuff. That's 69% of the economic engine of our country. So it seems the banks are not serving our entire community, despite what Mo and Jill just so brilliantly displayed with that amazing data, that support for recent immigrants and other minority-owned businesses is one of the most effective ways we can drive job growth and economic opportunity in Northern Virginia. So what can we do as a community to move the needle on this very complex and obviously longstanding issue? And I think the big step in the right direction starts with data, because data becomes policy. And I think it's the private sector that should be pushing on this very, very hard, because it's in the private sector's long-term interest to promote an economy where everyone has the capacity to consume, to buy the goods and services the private sector is selling. So I think most people on this line today are probably from the government sector and the social sector, but I believe it's the private sector pushing on getting this data that's going to really move the needle on it. One of the suggestions in that WBJ article is requiring the collection of information on race and ethnicity through the Community Reinvestment Act, which would be huge because it's one of the only ways we could actually make this financial system accountable. So I think we need more data about how money flows to minority-owned businesses and Black-owned businesses from the existing systems and structures, so that we can see more clearly what's broken and we can do more as a country and as a region to fix it. So with that, Bob, I'll turn it back to you.
Now, it sounds like we have another project here.
We absolutely do. So the data that was just presented, right, is on the economic contribution of immigrants to Northern Virginia. I think more data about what our financial and economic systems do to support them is the next step. Rather, don't do to support them. That's the next step.
I don't disagree, and I would ask Mo and Jill to unmute themselves. I have not received any questions in the chat box from our audience, but you're talking about data is a good point, and I'll start with Jill first. As you look at our work, Jill, and the fact that we didn't start getting race and ethnicity data on COVID until the middle of all of this, how do you see that changing, and what kind of new data do you think needs to be collected as we move forward?
I would say the new data that needs to be collected that we really are lacking is like what Eileen said, where we really don't have very good data when it comes to the business community and their race and ethnicity, as well as we don't have good data on like the impact of the businesses that have had to close in this region, and were these vulnerable populations. So none of that type of data exists and hasn't really ever existed from the Bureau of Labor Statistics or Census Bureau. So we really are lacking on the economic front when it comes to race and ethnicity. And I think more timely data, I guess, is what I should say, because Census Bureau does have the quarterly census of employment and wages, which has race and ethnicity. But again, it's not timely, and timeliness is very critical in crises like today.
Thank you. And Eileen, when you saw this new data, does it change where your organization is heading and what you're asking your partners to help fund?
It gives us the tool to promote the initiatives that we've identified. And yeah, Build Back Dream Forward is perfectly aligned with everything that Mo just pointed out. And, you know, you look at some of the takeaways. recent immigrants are 27.6% of our total population, but they're 48% of our essential workers. They're 47% of all entrepreneurs in the region. You know, it just seems so intuitive that promoting their success is tantamount to promoting the economic success of all of Northern Virginia.
And Mo, you do work all across the country. A lot of similar circumstances that you see here in Northern Virginia. Any unique twists for people who are doing a better job at collecting some of this information? You're muted. Well, let's see here.
Okay, I think I'm going to
There, we
bring
can
in the
hear you.
headphones. My apologies on that. For some reason, the headphones are having a big issue on unmuting me right there. And to answer your question, sort of, yes, we are seeing very the disproportionate impacts that we are seeing across the country it holds true. We, like I mentioned at the beginning of my COVID presentation, when this pandemic first struck, we knew that one of the best ways that we would be able to contribute and support our partners would be by providing this research so that people could make very tactical and strategic decisions with their resources and how to support their community overall. And so when you look at a lot of those essential industries, if you look at healthcare, if you look at people in the food supply chain, from agriculture to those that are in food processing plants, to those that are transporting that food, to those that are grocery workers, to those that are restaurant workers, they're disproportionately workers from the immigrant communities that are working in those sectors and in those industries. And so we have seen a lot of then local communities and states who have really needed to step up when it comes to the response. When it comes to how they can support these communities, I don't think it's a surprise to anyone that it's been a little bit difficult from a sort of a national strategy on what response can and should be looking like. And so increasingly and more, we've noticed that these local communities and that states have really had to step up in order to support these types of communities, whether that is from housing and rental support, whether that is their own plans to support small businesses through partnerships with foundations, that these communities are really stepping up to ensure that particularly communities that might not have access to resources that we have seen at the federal level or that other communities have, that they have access and they have a lifeline during this situation. So yes, I would say that the trend is frontline and essential workers across the country. Immigrants are definitely disproportionately working, and that as a result, increasingly, these state and local actors have really had to step up in order for their levels of support.
Could I ask Mo a quick question, Bob, about her?
Yes, absolutely.
Okay, so we were looking at the number of children living in immigrant families at our community foundation. We've been talking about that statistic, and right now, 1/2 of all children in Northern Virginia live in immigrant families, a full half. And when you look at the trend of that over time, that line is just going straight up and to the right. That's not just our future, right? That's our present, straight up and to the right. So wondering if you're seeing, Mo, a similar trend in terms of the impact on GDP of regions like ours, of immigrant populations. Is that trend going up as steeply?
I mean, I would have to look at the exact rate, but in short answer, the answer is yes. That like I mentioned, I mean, the U.S. has an aging population and a declining birth rate, and the only way to maintain sort of the economic activity that we have is through an infusion of workers, of families, and so that tends to come from immigrants. And I will say a lot of the work that we do at NAE is in particular communities in, if you looked at my slide where I looked at sort of everywhere that state and local is active, we do have a really strong presence in the Midwest and a lot of places that are suffering from population decline, and specifically because they are running into real problems when it comes to their workforce and their local economy, and they need to attract that sort of that immigrant population, that refugee population. And so I am struggling to recall at this point if there has been a single report we have released where the population has increased without either significant increase in the immigrant population or any sort of I don't think there's a single community that we've released research in where the U.S. born population has outpaced the increase of the immigrant population.
Right. But right now, as it stands, the recent immigrant population in Northern Virginia constitutes about 25% of our total GDP. Is that right?
Yeah.
So yeah.
Yeah.
Yep. 57 billion in GDP. 57 billion.
Yeah, I mean, nationally, yeah, I was just going to say nationally, yeah, immigrants do account for about 13% of the population. So, you know, it affects differently in different areas. I'm not going to pretend that immigrants account for 27% of the GDP in every community or every region across the country yet. But they have significant impact in almost every community, yes.
I have two quick questions from our viewers. One, and I don't know if Jill or if Mo, is there recent data available related to the arrived refugees and asylum recipients?
Yeah, so we do have some data when it comes to refugees, and asylum seekers are a little bit tricky, just because, you know, an asylum seeker comes in and then sort of they have to go through the process prior to being granted asylum versus being rejected as someone who is seeking asylum in the country, as opposed to a refugee who is designated prior to coming to the country before being granted entry into the country. So yes, we do have data when it comes to refugees across the country and their impact. I would have to pull up exact stats, but the answer is yes, we do have a lot of data when it comes to refugees and their impact, particularly their role as essential workers, as frontline workers. And we don't have quite as much when it comes to asylum seekers, but yes, when it comes to refugees and yeah, when it comes to.
Thank you. Thank you, Mo. Another question is, and I think it's a difficult one to answer with this panel, does the healthcare industry in Northern Virginia have a more challenging time combating COVID due to the immigrant workforce being a larger share of COVID-19 cases?
You know, I recently interviewed Stephen Jones, the president and CEO of Innova, and I want to say I am utterly impressed with the way they've handled COVID-19 and with the success that they've experienced in learning, growing, changing, understanding in learning on how to treat COVID-19. The whole thing just sounds like one great big success story to me. You know, he said if there was one thing he would do differently, they would not have stopped elective surgeries. They would have continued them, not only for their own business model, but because the hospital was actually a very safe place to be for elective surgeries. He said that the percentage of his own workers that have tested positive for the virus is lower, like far lower than the percentage of the entire demographic of Northern Virginia has tested positive for COVID-19. So it was actually a very safe place to be and a very good place to be if you wanted and needed certain elective or requested types of surgeries, not emergency based. I don't know, Bob, does that help?
You know, I think it does, and I think with immigrants being such a large part of this essential workforce, it's certainly put them in in difficult position in harm's way, and depending on whether or not they had sick leave or other benefits where if they weren't feeling well, stay home. I certainly think that that's had a negative impact on folks, regardless if they were in the healthcare industry, working in another place where being in close proximity to someone who was sick, it hurt them. There's one question here specifically for Mo. Many of the STEM workers that are foreign-born are on H-1B visas in North Virginia. Do you think recent proclamations from the current administration will have an effect on the STEM market and on the foreign-born population being able to fill those positions?
Yeah, I don't think it is any surprise that recent proclamations in June, the administration announced the suspension of H-1B visas through the end of the year. And recent regulatory changes that the administration is pushing through would have a certain number of limitations. So, for example, changing certain H-1B visas from being issued every 3 years to needing to be renewed every single year. And so these have, also probably to no one's surprise, are under litigation, that the business community is very concerned with, and are watching very, very closely. We have done research that has shown that for every H-1B visa that has been issued, 1.83 U.S. jobs are created. So by issuing H-1B visas, actually helping to create and stimulate economic growth within the U.S. as well. And that specific research was done in the years, I think, 2010 through 2014. So immediately in the recession that we had found ourselves in. And so using that, there's just no real reason to be putting that type of restriction or regulations in place. And so we have come out strongly against it. The vast majority of the business community has come out strongly against it. And it's currently under litigation. And we are watching it very closely, and then depending what happens in the next month or so, or next couple of months, we will await to see what happens next. But it is definitely, even whether or not it is legally, or whether or not it is legal and can go through, that type of tenor and sort of tone, and what that leads the people within the business community to believe, sort of, our valuation of foreign-born workers is definitely concerning. And so again, we're just watching it very closely, and are hopeful that some of those changes don't go through.
Very quickly, someone asked, will this webinar be posted for distribution? The answer is yes. It'll be on the novaregion-dashboard.com on the immigration study page. In a day or two, we've got to get it downloaded and uploaded to YouTube to be able to share. And then, Eileen, there was a question for you. What is the name of that organization that coach minority business owners?
It's called
Go ahead.
It's called Eureka, Ureeka. They were built to be an online business. They did not pivot for COVID-19. They actually launched in early 2019, entirely online. They were started by Nancy Santiago, who is, she's had an amazing career. She's been in the Obama administration. She's been in philanthropy. She's the current VP of philanthropy at Hispanics in philanthropy. So she's been on the policy side, the government side, the philanthropic side, and she was one of the co-founders. And Melissa Bradley, who is a national expert on minority business owners and the inequities surrounding their world, from the structures and systems that are mainstream. She's a full professor at American University. I think she's a visiting professor at Georgetown. And she and Nancy stood up this business, and they have the cultural competency to make it a go. And the Northern Virginia Economic Development Alliance is impressed with their particular expertise and wants to tap it for the region.
Super. I'm going to ask this one of Eileen again, just given the work that you've done. Someone was asking what work has been done to grow the number of folks who can help the undocumented meet these legal challenges of becoming, resident, get their papers together to become documented in this country.
So there are a number of organizations in the region that do just that, including some of the free legal service organizations. If you go on, if you just Google COVID-19 Response Fund for Northern Virginia, our webpage pops up. Scroll all the way down to the bottom and read the round 5 grantees, the 22 organizations that received support from us to help them with not just COVID-19, but racial justice and equity, which they're fighting on the front lines of every day. And several of those organizations actually specialize in legal services to recent immigrants.
Okay, thank you. Our time is really up. We were asked a question that the slides from today we will have put up on our Nova Region dashboard website either later today or tomorrow. I want to thank Jill and Mo and Eileen for being here today, for all your good work. And I think from the questions and the conversation, I think there's some more work that we could accomplish working together in this area to provide information and, to your point, data to the policymakers and the business leaders about the importance of the immigrant community in our region and our country. And a real wake-up call to our friends on the other side of the Potomac that the next round of CARES Act is really desperately needed. The House has passed 2 versions. The Senate seems to be resistant to taking one up, but I'm hoping calmer heads will prevail and the Senate will take something up that's meaningful for the country at large. With that, thank you for everybody who joined us today. This will be up later today or tomorrow. And stay safe, stay healthy. Remember, wear a mask, wash your hands, employ physical distancing. If my mom was still with us, she'd say, get your flu shot. Thank you.
Thank you, Bob.
Everyone.
Take care.
Thanks,
Bye-bye.
everyone.
Bye, everyone.